Once we go to the ovary, can we do gross fanning of the... So suppose you entered the vagina. We are now needle in the ovary. Can we move the probe like this up and down, right and left? That's the question coming out.
We put the needle outside in the guide and then do fanning.
You can't do fanning. If you do fanning, you will tear the whole ovary. Why do you want to fan? The needle has to be out of the ovary. Then you can do anything.
Yeah.
But the needle is in the ovary. You leave aside fanning. You can't have movements more than 1 or 2 degrees here and there.
If needle is outside the ovary,
Then you do anything. Then so there's no problem.
we can also rotate the probe and focus the follicle.
When the needle is not there, it's like a simple TBS probe. You can go anywhere. Then it is of no concern to us.
Sir, if we do cross fanning, the media will lose no from the needle.
What?
Again, the air will come inside the.
No, because pressure of your
Inside the vagina.
when you're outside the vagina, the needle is inside the biopsy guide, no? And pressure is off. There won't be any air suction occurring.
What will be the chance?
No, but how much will you move in the vagina? आप कितना move करेंगे आप? You'll never have a situation where, see, in the vagina, you'll only move like this. You'll never move like this and like this. How is it possible?
It should be horizontal.
Think, there's a vagina in front of you. अच्छा ET वाला नहीं है. There's a vagina. You've gone inside. Listen, just be logical. You have bladder up, rectum down. Those areas you'll never touch. You'll only go like this. So once you have taken all the follicles from here, or you want to reinsert, depending upon. So you take this ovary, come back, and then you want to take the needle out. The pressure off, needle out, and keeping it like this only. No? You're going like this, maximum few degrees here and there. You're not doing like this. You're never doing like this. How can you do like this? Because it's rectum and bladder lying up. Get my point? In case of the vagina, क्या space थोड़ी है हमारे पास? Vagina you can only do like this. Vagina doesn't allow you to go for pickup. For a scan, you can go to the rectosigmoid junction, you go inside or look at the bladder like this for any bladder calculus or any polyp. But here, you're not going there. You're only moving like this.
So with that only micro movement, it's very difficult to put all the follicles on the guide.
They come. माइक्रो एंगुलेशन की तो बात कर रहे हैं. देखो अब मेरी बात सोचिए कि आप प्रोब हो. आप सोचो, थिंक दैट यू आर लाइक ए प्रोब.
माइक्रो एंगुलेशन प्रोब का ही होगा ना. नीडल तो उसके साथ ही
नीडल तो प्रोब के अंदर ही है ना. तो नीडल यू कैन नॉट मूव. नीडल विल ओनली मूव अप एंड डाउन. नीडल विल गो इन आउट. In, once it is in, then don't rotate. When it is out, you do anything. When it comes at the ovarian border and it is still inside, that time you do 1 or few degrees here and there and do
aspirating the follicle. Now, like I'm about to finish that follicle, and they are saying that you can do some small churning movement so that it is not attached to the wall. So, is it really successful? So, I'm also doing because my seniors are doing. So, is it really going to help? Or
they say follicle curettage is of no use. But there are you want to do follicular curettage to ensure it's not needed, because I've told you, once you enter the follicle, what do you do? In case you keep it bevel up, then it is sucking from here. When this fluid comes down, the lower fluid goes up and gets sucked. At one point of time, the whole follicle will come and hug you. This is what is happening. You are agree with this? As it is, you're sucking, you'll find that some pocket may be left here. Hub downwards, right, and suck it. Any problem? No problem. So what some people do is that when when it is hugging it, they want to gently cure it. Curate has got, what will curate give you? You are aspirating ovarian tissue. So why do you want to do it? It's not needed. When the follicle comes, when the follicle comes and starts hugging your needle like this, and then you just rotate and take it out. There's no logic in doing curettage. Curettage, what logic does the curettage has?
सर मैं तो एक बार ही कर रही थी ना, तो like I started with 1 ovary. मैंने 3 follicle निकाले and वो जैसे बताते हैं तो embryologist ने बोला first tube empty, second empty. तो my senior is like No, because you are not curating the follicle, na, that's why it's not coming. And the moment she started curating it, and it was like, okay, now. Then she told me to curate it.
No,
Add-
curate is a different word. I am saying that whether you twist the needle inside or not. So I have told you that you have to twist. मैं तो कह रहा हूँ twist करने से क्या रहेगा? Twist करने से you create eddy currents.
Will be moving everywhere.
You create an eddy current so that with this current it will come and detach. That I am saying. But I'm not telling. Curate is a different word, madam. Curate means that we go into the follicle and then when it is hugging it, then you start doing like this. That is called curettage. That is not allowed. But creating an eddy, I'm saying that the moment you go inside, you are doing like this to see the tip better. That I'm saying already.
So one more
So curate is the wrong term. On the mic.